You talk about defenses, which of course is a big concept in psychotherapy. Does it have a different flavor in your work here?
It does, because I think so. One of the great learnings of the last decade or two has been that defenses aren't just to be bashed through, but they need to be respected because they're always developing for really good reasons.
Mm-hmm.
So, for example, if I came from, so I've worked many, many times with children who came from very violent homes, and then they were adopted into very kind, benign, loving homes.
Yeah.
But their nervous system and their brains do not see a benign, loving, caring person in front of them. They see a scary person. So the adopted parent might move towards them to try to, I don't know, brush their hair. And the young person might flinch and slap back. So in other words, they are defending against a danger that actually no longer is there. It's very like the cell danger response. The body thinks there's danger and won't relax. The nervous system won't relax.
Yeah, and in that context, you also talk about unconscious expectations or predictions. So the
Yes.
child is somehow, based on their past experience, they have and with children, but especially with adults, I imagine we have unconscious expectations or predictions that something bad is going to happen. And maybe unconscious because that was formed so long ago.
Exactly. I think often these things are formed pre-verbally, and they are very deep in terms of almost embodied ways of being in the world, which is the whole prediction error idea. The Carl Friston, who's one of the most important neuroscientists, probably talks about this idea of prediction errors, which I think is very, very useful. So that adopted boy who lashed out when his parent was trying to be kind was making a prediction error. And so we might think of that as a defense, which was there for appropriate reasons. But then how do you help them lower that defense?
Right.
And that can't happen until, first of all, they feel safe. And so the way I think about defenses is that they have to be respected, but not too much. So we have to watch the person's nervous system to signal whether or not this is a defense that can be challenged by a bit of pressure. And often you see that in signs like sighing or tensing muscles or clenched jaws. These are what a form of therapy called ISDDP, which you might know about, talks about in terms of striated muscle, which is kind of more conscious muscle control. If you start talking about a trauma and somebody goes into kind of, I don't know, they start saying they feel faint or they feel sick or they need to go to the toilet, that normally is a sign that that's overwhelming anxiety, and we need to respect that by moving back and helping them to regulate. So in a way, defenses can either be challenged where it's appropriate, or sometimes we need to step back and help people feel safe enough before their body signals that that actually these defenses can be challenged.